So if I were to talk to you about making plans for the end of your life, most people would be likely to think about things like making a will or making a funeral plan, and those are good and important things to do. But planning your care in advance is really about thinking more widely about the period leading up to your death. And people find this often quite difficult to talk about, but really the things that we invite people to think about are, what would happen if you couldn't look after yourself? So questions like, where would you like to be looked after? What would be important to you at such a time? Where would you like to be when you're dying? That kind of question, really. So it's inviting people to think in more detail about a period towards the end of their lives where maybe they would be frail or unwell and not able to look after themselves.
So the benefits of advanced care planning for the patient are that things that are important and can be written down so that they can be carried out later. Families too, that actually we would say advanced care planning gets families talking about what's important to the patient, because that's really who we want care to be focused and fixed around. So it's a really good time for them as a family. It's really good for us as a service, as a hospice, to know that we're actually doing what the person wanted done to them, and not doing things that they didn't want. So it's really good for that too. And also about developing relationships with health and social care professionals, that advanced care planning and talking through those issues helps us understand our patients, and also for our patients to understand about us and our services too.
So what we've done in Milton Keynes is to design this document called Planning Your Care in Advance, which looks like this and which is downloadable from the internet. And it's really an invitation to start thinking about these issues that we've mentioned. It's really designed as a conversation starter for you to look at it and think about the elements of it that would apply to you.